Daniela. The nurse cares for a client who is 2 weeks post-chemotherapy and has a potassium level of 6.5. The nurse questions the healthcare provider regarding which prescriptions, and it's a select all that apply. So again, you can treat this like a true or false. So I want you to walk us through each one of the options and explain which ones are true, which ones are false, and why.
Well, the first thing I would do is the potassium level is 6.5, so I know that that is high because the normal is 3.5 to 5.0. So I always, if there's a lab value, that's what I always look at.
Okay.
So then I go to the question or the answers: administer sodium polystyrene enema.
So that's K-exolate.
Oh, okay.
It's the generic name for K-exolate.
So that'd be true. Because we want to bring down the sodium level back to normal. So we're going to, is that right? Potassium. So we're going to give them that to rid them of the extra potassium, right?
Go through the next choices,
Okay.
and we'll circle back around when we're done.
IV push 25 grams of dextrose. Okay, so that's like, yeah, sugar. And like in my thinking, I'm thinking, okay, insulin, if you give insulin, that pushes the potassium back into the cells. So, is that what dextrose does? Or is it? IV push 20 units of regular insulin. Oh, yes.
Okay.
Yes. True for C, for sure.
But look how good you did without looking at the others. You just took them one by one, and then you looked at the next one, and you were like, yeah, that completely solidifies my thinking. All right, keep going.
IV push 50 milliequivalents of sodium bicarbonate. Sodium bicarb. What's that do?
This changes your pH, is that what it does?
Yeah.
Ah, so we wouldn't really
It's
want to
like
do
your
it.
base. It is potassium acid. If your potassium's up, aren't you acidic though?
See, my brain is not even thinking like that.
Maybe we're reading too much into it.
This is a hard one.
All right, what about the last one?
And then the last one is infuse normal saline at 50 milliliters an hour. So, okay, so C is something we would do, so we are not going to choose C
Right.
because it's a correct answer. So, I'm going to say, okay, an A, K-exolate.
You would do that.
Well, that's what I'm saying. That
But
brings
it
down
bonds to the-
that brings down the potassium. So we don't want to question that order either because that's something we would do. So B, I think we would question. We're giving them. We don't want to give them sugar.
Because ketoacidosis also makes you acidic. So if you have a high sugar, is what I'm thinking. I'm just thinking too much acid here.
I have not. My brain is not even on
I
acid.
just want to stick to the treatment plan. Not potassium levels. Right.
I'm not even thinking.
When the
acidic.
potassium is high,
This is what happens when 10 nurses
give
say
him something to poop it out. Give him IV insulin. I'm just going through like the bullet points in my head.
I don't know that the saline
2 of those make
is
sense to
enough.
me. The other 3 do not.
Because keep vein open is like, what, 20 to 30, and that's 50. Why is that not?
So I don't think the dextrose or the saline are applicable. I mean, because it has really nothing to do with your potassium.
All right, y'all ready?
Yes.
Okay. Did anybody hone in on the fact that the patient is 2 weeks post-chemo?
No.
Nope.
Where'd that go?
I was looking at potassium.
So y'all inserted ketoacidosis and I feel like DKA and all kinds of other things that hadn't happened. But nobody actually read that the fact that this person It's 2 weeks post-chemotherapy. All right. So what happens after a couple of weeks of chemo?
Your immune
Immune
system's
system
down.
is down. They're depleted of a lot of things.
Depleted of what?
Things.
Fluids.
Okay. Volume, electrolytes maybe. What else? How's their white count and their platelets?
Down.
2 weeks is right when they'll start to hit their nadir for their white count. It's right when they'll start to have low platelet counts. And what does option A include?
Just making them poop it out.
Oh, taking more away.
Nope.
No.
It's rectal.
Oh, yeah.
Ah.
Can you do that with someone who's neutropenic or who has bleeding precautions? So you had to read just enough into it to know that if they're 2 weeks post-chemotherapy, that they would naturally have possibly pancytopenia, and you might question that. Now, dextrose and insulin are always given together for high potassium. They're given IV usually because the sugar and the insulin will drive the potassium back into the cell, out of the bloodstream. So you had definitely the right thinking there. And while we're on that topic, you always give the dextrose first, because then if you lose the IV, you could technically still give the insulin sub-Q. If you give the insulin first, you can't give the sugar sub-Q, and then you've caused somebody to crash hard. Bicarb is not what you're going to think of as a first-line treatment for potassium, but it is a correct action. And you're right, they are having, you think when somebody has high potassium, they probably also have some acidosis, okay? So that is a correct inference. Now you took it a whole different direction with ketoacidosis and all that. So there's just regular old metabolic acidosis hanging out there that can sometimes be associated with high potassium levels, okay? So that one's okay. And the saline, we could start it at 50, but we might come back later and say, you know what, I really want this guy to flush out a little bit more. So you wouldn't question it to start with. You could go ahead and hang that, but then you might come back and say, you know what, urine output's really not catching up. I'd like to do a little bit more damage here.
So the answer.
The answer is literally just A.
Well, I would've got
Feel
that
real
wrong.
good about myself right now.
What did you learn about yourself?
Just told me up. I'm like, hopefully I walk out today feeling better.
But now, so let's tear that apart a little bit though. How many thinking errors did we make as a group?
A lot.
The whole thing.
All the things. We did all the things. So you zeroed in on the fact that the potassium was high, and that's completely appropriate. But don't miss what else is in there. Don't miss what else frames up that question. So if it was just a straight up the potassium is 6.5 and we've got to do something, or 7.2 or whatever, like all of those things would have been correct. And so when you read through them and you're like, well, I really wouldn't question any of these. That was, again, your cue to go back, and Ashley kind of pointed that out. It's like, wait, it says which one would you question? So we went back and caught that word, but then also go back and see what else you might not have found, right? So, and in this case, it was the fact that the person had had chemotherapy, and they might have some issues with bleeding or infection coming up if we do an enema. Is everybody cool with that one? That may be the hardest one we do today, I'm not sure.